Hello, Wave Country. I'm John Ramsey, and welcome to the Thursday edition of Wave 3 Listens Live. The key word today is freedom. We're going to talk about the meaning of freedom and what it means to you when it comes to oral health. With us now is Dr. Regan Ackerman. She is with Freedom Mini Dental Implants. All right, Dr. Ackerman, welcome back to the show.
Hi. Thank you.
Your partner there, Dr. Larry Stroud, is on a little vacation.
Yes,
is that right?
Yes, he is today. Yeah, flying solo today.
Good for him. Well, I'm looking forward to chatting with you a little bit because I get to know you a little bit better and find out. Let's talk about the reason for the rebranding. It went from Mini Dental Implants to Freedom Mini Dental Implants, and after you kind of explained it to me, I understand it. So if you would, tell that story.
Yeah, certainly. We just kind of wanted to add the freedom part to it because a lot of our patients, what we're doing for them is we're giving them the freedom to smile, the freedom to eat again, the freedom to chew. Some people are held prisoner by their dentures and they stay in their house, so the freedom to go out again and to socialize. So we just thought the word freedom was really important for what we do for people.
You know what, and I think it's fitting. I don't know who came up with this, but they're genius, marketing genius. Freedom Mini Dental Implants. Again, we have the number up on the screen, and if you have a question for Dr. Ackerman, that line is always open, 571-5723, or wait, 571-536. I'll get it. 5263. I have so many numbers jumbled in my head now.
Two numbers.
All right, there we go. Okay. Dr. Ackerman, all right, let's chat a little bit. You mentioned, the freedom to smile and the freedom to eat the foods that you enjoy most. And there's also another component, too, here, nutritional value, because a lot of these foods that if you do have issues with your teeth or you're missing teeth, they can really be hard to eat, and most of them are nutritious because we're talking about fibrous foods.
Right.
I mean, things like, green leafy vegetables, nuts, steak, which is good for you because of the protein content. So talk a little bit about that as well.
Definitely. I mean, we see people struggle every day with dentures. They're, loose and popping out, and they can't eat things with them that they want to eat. They end up on soft food diets. They can't eat those meats and those vegetables, which, like you said, can lead to overall health issues, GI issues. I had one patient that came in and she said her diet had gotten so bad because she couldn't eat a normal diet. She knew she was eating sugary foods all day, every day, and pretty much led to her becoming diabetic. And she knew it. And so she came to me searching for a way. She's like, I need to eat healthy. I need to be able to chew my food, not stick on a soft food diet. So it certainly affects, overall health. It's not all about the smile and the aesthetics and the, things like that. So it's definitely, so you can eat and chew and be able to go out to dinner and eat confidently in front of family members. And like I said, not be held hostage by your dentures because you don't want to go out, in front of people and try to eat and it flops out, or you have to excuse yourself to go to the bathroom and rinse and feel like you got food everywhere and things like that.
Dr. Ackerman, I also want to talk to you about something I talk often with Dr. Stroud about, is that, that superficial, I say, but really it is important. When we talk about freedom, the freedom to smile, because Dr. Stroud was saying, and I'm sure you see this often as well, that he has a lot of patients who, are always covering their mouth, and they're embarrassed by their smile, and thanks to the Freedom Mini Dental Implants, you no longer have to go through that. Do you see that often, people who just, I think there's one gift that everyone has, it's like you should be able to smile. Yes,
they're trying to hide it, or, they may look mean all the time because they don't want to smile, and, people may not approach them and things like that. And I think it's really unfortunate because I see a lot of people get stigmatized because they're denture wearers. People may think they're not as educated or things like that. But I have so many patients that are great people and just have had a bad history of, growing up without access to a dentist or things like that, and they just want to smile again and they want to eat again and they don't want to be stigmatized. People talk about, if they're diagnosed with cancer all the time, but people don't talk about their dentures because they don't want to. They're afraid to, and they don't want to talk about it, but they need something like the mini dental implants to help either their denture stay in or get rid of that denture completely so they can taste food and eat what they want to eat and smile again.
All right, the number again is 571-5263. I finally got it down pat if you have a question for Dr. Ackerman. Now, proof's in the pudding. I love looking at these before and after pictures because you'll see the direct effect. Okay, this is Glenn, correct?
This is Glenn, yeah. Glenn has a great story. His wife was a patient of mine, and she knew what I was doing with these mini dental implants, so she had him come in. He was probably in his 20s or 30s when he was in a car wreck or some sort of trauma and ended up having to lose all his teeth. Yet another scenario, great guy, you know, did everything right, but ultimately ended up losing all his teeth. He tried to wear dentures, couldn't do it, was miserable, so he gave up on it. He probably hadn't worn any teeth for maybe over 10 years, okay? And so he came to me, and I'll show the models later, but we did kind of the snap-in dentures for him. You can show his after picture, and it probably took 10 or 20 years off of him. Yeah. So
and that's a genuine smile.
That's a genuine smile. That's like, I'm so glad my wife made me come in here and get this done. The kind of two neat things about him, one was he really wanted to be able to eat peanuts. That was his thing. I want to eat peanuts. And so I actually talked to him last week, and he's like, yes, love it. I can eat peanuts, eat whatever I want. I think the other funny story about Greg is he said his phone didn't recognize him anymore. You know how we all have Face ID or our photos are done by our pictures?
Right.
He's like, I kind of had to retrain my phone on my new smile and my new face, and I thought that was a really neat story.
Yeah, it's kind of tough to say, hey Siri, I'm much more handsome today. Check this out. Congratulations to Glenn. That's a great story.
Yeah.
Okay, if maybe you're listening to this and you say, you know, this all seems too good to be true, I have even better news for you, is the fact that the cost is significantly less, isn't it, Dr. Ackerman?
Yes, yeah. You know, I've been doing this for over 10 years now, and one of the reasons I got into it is it was so frustrating for my denture patients. I was frustrated for them. I make them, you know, a great denture, but it's still, they're just miserable with it. And the only other option at that point was go to the surgeon, be cut open, have stitches, maybe have to go to the hospital. You know, it was a very invasive surgery, you know, going to multiple doctors, multiple visits and things like that. So with the mini dental implants, it's a much less invasive process. Less time, less healing, no stitches, you know, things like that. So that's kind of, you know, it's a lot easier than the old way.
Yes, and a lot less expensive.
Yes.
There's all of these positives. We're going to talk about, there's a couple of different procedures, and one of them may fit you or a loved one. If you have a loved one, maybe you're missing a few teeth, maybe you have a child who's missing a tooth or two, maybe you have a bridge or dentures and you'd like to throw them away. Wouldn't that be a happy day? So if you have any questions for Dr. Ackerman, 571-5263. When we come back, we're going to talk about the different procedures, different methodologies, and as I said, one of them may fit you. Let's throw away those dentures. Freedom Mini Dental Implants. 571-5263. We are Wave 3 Listens. Welcome to Thursday.
You're doing 71 live sporting events outside. You pretty much rely on the weather. It's important to have accurate weather information, like the weather information we get from Kevin Harnett and the Wave 3 weather team.
Here's the current radar view.
If you don't have the Wave 3 weather app, you need to get it because it's something that I live by each and every day.
We just got a lightning push notification from the Wave 3 News weather app right here in downtown Louisville.
So when you're making plans, especially plans that involve being outdoors, it's something that you can rely on.
It's Briarfest at the beautiful Kentucky Horse Park, the 3-day weekend event that's all about horses.
It's the best 3 days of the entire year.
It's my favorite. It's better than Christmas.
See exciting live shows, free kids activities, and meet and greets with celebrity horses and trainers. Plus, get a free limited edition Briar model horse with every ticket.
Briarfest is amazing.
Briarfest 2018, a fun family festival celebrating everything we love about horses. July 13th through 15th at Kentucky Horse Park, Lexington. Visit BriarFest2018.com now to get tickets.
And welcome back. Freedom Mini Dental Implants. Dr. Regan Ackerman is with me now, and you saw the before and after pictures of Glenn. If you need more proof, listen to this. This is fantastic. Okay, so I was talking to Dr. Ackerman, and she was telling me that you have performed your procedures on family members.
Yes.
Now that's proof right there.
Yes.
Tell me a little bit about that.
Yeah. Actually, my mother-in-law, she had begged me for years to make her a partial because she was missing teeth in the back, and I refused because I see patients that are miserable every day with partials and hate them. And so finally, when we started doing the mini dental implants, I said, I have a solution for you. So we did the mini dental implants and replaced all her back teeth with mini implants, and she is so happy and loves them, and we're getting ready to do more. So that definitely, I tell patients all the time, like, I do these on my family members. If I was missing a tooth or needed it, this is what I would do on me or my my husband or my parents, you know, so that's how much I believe in them.
Fantastic.
So,
You know, that says a lot
yes.
right there, because you're going to have to deal with that mother-in-law.
I see her every day, yes.
That's a good story. 571-5263. All right, let's talk a little bit about the different procedures, because there's some options here, and some of them it may be a financial decision, and that's okay. Everyone's on a budget, but it also may be, you know, just what fits you best. What do you want, right?
Certainly, yeah. And I'll show you first what we did for Glenn, okay, the snap-in denture. So in his case, you know, we'll imagine this is your mouth, you know, your gums without any teeth, okay? And we don't put you to sleep, okay? You're, you know, wide awake. It's very minimally invasive. The most you might feel is just the numbing, you know, little couple pinches, pricks to put the Novocaine in, okay? And then, you know, we just place these little tiny screws, which are the mini implants. No stitches, really, you know, no bleeding or anything like that. And that same day that we place these implants, we have this denture here with these attachments, okay? And then we're able to snap this denture in, and you leave that same day with your denture snapped in to the implants, and we can do top and the bottom on the same day. And many times, I mean, I've had people that come in the morning and get their implants done, and they work a night shift, and they go to work that night. You know, it's you know, very minimal, you know, healing and pain. So this is kind of what we did for Glenn, was the upper and lower snap-in denture, and that's, you know, one of the more affordable things we do for patients, and it typically is about, you know, half the cost of the traditional surgical route.
Half the cost. So, and the advantage there is that no more glue. They're secure.
Yes.
You can eat the foods that you love and not worry about your denture slipping or
not going to flop out in the middle of dinner, things like that. Yes, definitely.
Okay, so that's one of the options. Now, what if you want what I consider really having a new set of teeth, and it really is. I mean, this is like, you know, you get an irrigator, you're brushing them, or you're cleaning them. Everything really is like, it's like starting all over with new teeth.
Definitely.
Right?
Yep. We kind of tell people this is like getting your third set of teeth, like having your teeth back, okay? And in this process, you know, same model, you know, missing the teeth, we just put more implants in, anywhere from 10 to 12 implants, okay? Same process, same numbing, wide awake, no sedation, no, you know, not cutting on your gum or bone or anything like that, okay? And then that same day, you'll leave, you know, with temporary dentures in, and about 3 weeks later, we can cement and put glue in these
just porcelain teeth.
Porcelain teeth. The biggest advantage of this, and this is the nicest thing we do for people, it's so much fun doing these for people because they just love it, but you don't have that denture on your palate anymore. You can taste your food. You don't have all that bulkiness on the outside of the denture. It's, you know, if you want to do corn on the cob and apples and chew all those fibery foods, healthy foods, this is the way to go. It's just awesome. These are the people that come back and they've gained 10 to 20 pounds because they can eat what they want to eat again.
Yeah, this is the time of year to enjoy that too, you know,
definitely.
Because fresh vegetables and fruits, and I can't imagine not being able to eat the foods that I love, and also the foods that are nutritious for you as well. So, okay, so that's, and we'll get into another option. Before we do, we've asked for phone calls, 571-5263, and ask and you shall receive. Albert is joining us now. Albert, good afternoon and welcome to the show.
Good afternoon.
Hi, Albert.
Yes, I have like somewhere where my back teeth have been pulled wisdom too, and I like to know, like my teeth in the front has spread apart. How can I get that repaired and fixed?
If I heard you correctly, it sounds like you're maybe missing a couple teeth in the back and maybe some in the front. Is that correct, Albert?
Yes. Well, the ones in the front have spread apart to try to cover up the ones that's been missing in the back.
Gotcha, because you're missing those teeth. Yeah. I mean, obviously, without seeing you, and we do free consultations. You're welcome to call, you know, anytime, and we'll do a free consultation and take a look at you. But yeah, we replace missing teeth, not just, you know, it doesn't have to be a full mouth of teeth that you're missing. We replace 2 to 3 teeth. We can, you know, look at that space in the front and see what your options are to close up that gap. But we can definitely, replace, single teeth, multiple teeth with the mini implants. And if you stay tuned, I'll probably show a model of that a little bit later too.
Yeah,
so.
Albert, perfect. He helped us with the segue there.
Yeah.
So let's talk about that. There are probably quite a few people who are missing a tooth or 2 or 3 . So the options are there. The choice is yours if you'd like to replace them with Freedom Mini Dental Implants.
It's not, just dentures with the mini implants. So if we can kind of show this model here. So say you're just missing, maybe 2 to 3 teeth, same concept. We can put, the mini implants in there, okay? And then same thing, you get the nice pretty porcelain teeth made, and then that kind of cements and glues onto those implants, okay? We can do it for a single tooth. It's done, let me see if I can get an angle there, in the front there, okay? And a lot of times I do this for people that are wearing those miserable, what we call flippers. They've had them for years and they hate them. They've been told that they don't have enough bone for a traditional implant. That's one of the biggest things we help people out with. They've been told they can't have an implant, and they think that's their only option, is this flipper. And it just bounces around, moves around. They can pop it in and out with their tongue. It kind of becomes a party trick after a while.
Not true.
Yeah. So, but they come to us, and with these mini implants, it's so nice because we don't have to have a lot of bone. I just have to have some bone, okay? And then we can put an implant in and put the crown on there, the tooth, and get rid of that flipper. Ditch the partial, and get your smile back and not have to worry about that. We do this a lot too for like younger people that were, a lot of times some people are born without one of these front teeth, and they've been told they don't have enough bone, but we're able to solve that problem with them too with the mini implants. So.
Freedom Mini Dental Implants. She loves them so much, she's using them on her mother-in-law. Well, I mean, that says it all right there. So I want to hear some of the reaction that you do get from patients. I was talking to Dr. Stroud, and he was saying, back when I would do root canals when I was practicing general dentistry, he said, didn't get a lot of hugs,
for sure.
Not a lot of flowers when I gave a root canal.
Yes.
But when you change someone's life, and they're confident about their smile, and they have the freedom to eat the foods they love, and the freedom to smile and feel good about it, to pose for pictures during holidays and memorable moments, that has to feel good for you. It's very rewarding, and that's why I love what I do on a daily basis. Just hearing people come back with their stories, and everybody has a different food that they're like, I can eat salads again. What's your favorite? So my favorite food, pizza, all day long. Pizza, anything with cheese and bread. Eat it all day long. And that can be chewy, so someone with dentures, if they're loose or if they're missing a couple of teeth, I could see where that would be a challenge. Yeah, sticky foods, just pull it right out. Yeah, so, but it's so rewarding to hear all the patient stories and coming back. And, like I said, some of them gain weight because they're able to eat again, or their health improves, overall health. But it's very rewarding to hear all the stories. And sometimes I tear up sometimes because they tear up when they see their smile and they're so excited about it, so it's very... sometimes, like you said, there's a little bit of a stigma with dentures. And to me, maybe it's a difficult conversation. Perhaps you're watching and a loved one, maybe it's your mother, your father, your spouse, who has been complaining about their dentures and ill-fitting dentures and refuses to wear them, and it's really a point of contention. Yes. So what do you recommend for that conversation? If someone's watching and they say, I'd like my husband or my wife to go in and see you at Freedom Mini Dental Implants, what do you suggest they do? I welcome them to come in. It's a free consultation, and we see husbands and wives together all the time. And it honestly helps if they're there together and can see how this works together. We can talk through it together and kind of get through it together. Because that's the worst thing in the world. Somebody comes in and I'm like, where's your denture? And it's in their pocket, or it's out in the car or whatnot because they're not wearing it. And I know it frustrates the spouse, but the spouse doesn't know what they're going through sometimes, and that person could be suffering in silence sometimes too and not tell anybody. So, but we see husband and wives all the time, mothers and daughters, like we welcome as many people in the consult room as you want and kind of show you your options and go over what we could do to help you. Yeah, if you put mom or dad in a better mood, then it's good for everyone. Yeah, that's right. 571-5263 if you have a question. Again, Dr. Regan Ackerman, it's Freedom Mini Dental Implants. We'll be right back on Wave 3 Listens. Yes, we're live.
At Belterra Casino Resort, the best days start with doing what you love. Every moment is cause for a celebration. And some nights should never have to end. Belterra Casino Resort, your everyday escape.
Sam doesn't just care about his client, he cares about his community as well. Once my case was complete, I continued to come down and keep a friendship. I'm a part of a nonprofit called Hope by Hope, and Sam Aguiar took a liking to the things that we've done and wanted to play part. Sam pitching in was like a game-winning jump shot. Most definitely feels good to know that we have an ally uplifting our community. I'm Aubrey, and I'm an actual client of Sam Aguiar.
Dr. Regan Ackerman, Freedom Mini Dental Implants, 571-5263 if you have a question. You know, it's interesting because when Dr. Stroud, when you come on the show, we have so many calls because I think, like you said, people are uncomfortable really talking about it, but when they have a solution like Freedom Mini Dental Implants, oh, this is exciting.
Yes.
And when it's, you know, cost efficient, which it is, yes. When it's less invasive, when it's not painful, when it's really rather turnkey and easy.
Too good to be true, but it is true. So
it is true.
Yes, yeah, and I know a lot of people want to know about cost, and of course every situation is different. But normally people come in with quotes from the oral surgeons, or they've had quotes, they needed a sinus lift or a bone graft and things like that. And on the average, our quote and cost that we give them is usually anywhere from half the cost to a third of the cost. Okay, I mean, like I said, had a patient a couple weeks ago that had been putting it off. She'd been missing her front 2 teeth for many years, and she thought she was going to have to pay tens of thousands of dollars. We were nowhere near that, and she was like, that's it, and she, like, on the schedule the next day, and we got her done.
Wow.
So yeah, it really is just come in for the consult, and we'll take a look.
Fantastic. All right, let's go to the phones and talk to Stephanie, who joins us now. Stephanie, good afternoon, and welcome to the show.
Hello. I have a question about my fiance has gum disease, has been told he's had 1 tooth pulled, and he's very leery. He just knows he's going to have dentures, and he's only 49, and I'm like, I think you need to try this. Is this something that he can do with gum disease?
Yes, and I'm so glad you asked that question. That's the perfect question, because we hear that all the time. So many people think because they've been diagnosed with gum disease, periodontal disease, and they've been told they've lost bone, and they don't think they have enough bone for implants. But like I said, with these mini implants, we don't have to have as much bone, and we treat people all the time that have lost teeth because of gum disease and infection and things like that. But he sounds like he would be the perfect candidate for what we do. Gum disease is not a contraindication or does not mean you cannot have these mini dental implants at all. That is a great question. I'm so glad you called in.
Thank you for calling. 571-5263. If you have a question, maybe it's 1 tooth, maybe it's a bridge, maybe you'd like to throw away those dentures. Again, Freedom Mini Dental Implants. Okay, Doc, when I've talked to Dr. Stroud, I wanted to hear your comparison. I often compare it to, like, as far as glasses and laser surgery, and everything evolves. And really, this procedure is relatively new, I guess about 15, 20 years old, somewhere in there. Yep. So this is relatively new. Dr. Stroud always says, well, it's kind of like if you had an appendix that needed to be removed. Before, they had to cut you open. Yes. It was this long process and the healing time. We're just taking a little laser.
Yes.
It's similar to that?
Very similar concept. Before, they'd have to cut your gums open, expose bone, you'd have swelling and stitches afterwards and things like that. Like I said, we're not doing any incisions. It's minimally invasive, just like you said, like laparoscopic surgery compared to cracking your chest open, okay? So yeah, very minimal, little pinprick, get you numb, little tiny hole, put the implant in, and I know it sounds too good to be true, but it's not. I've had so many patients that, we explain the process, and I think until we actually do the procedure, they're like, that's it, you're done? I'm like, yes, that's it. You get it worked up in your head so much, but it really is so minimally invasive compared to the traditional and the surgical route. And it's been around, like you said, 15, 20 years. So there's studies that, this is just as successful and just as good as the traditional and the surgical implants.
What led you down this path? Was it you were a general dentist? You practiced general dentistry as well, family dentistry?
Yep. So I'm a general dentist, been doing it a little over 10 years now. And same thing, like I was just as frustrated as my patients were with dentures. Sure. Making a new denture denture, and I'm like, you know, I always said I didn't wish dentures upon my worst enemy because, you know, it's not fun wearing just regular dentures. So I was looking for another solution for my patients, and, you know, and wearing partials, or they were missing one tooth and they didn't want to go to the oral surgeon and have to wait 6 months to a year for a tooth and things like that. So I was just looking for another solution. And so then I went through the same training Dr. Stroud did with Dr. Todd Shatkin up in Buffalo. He's kind of the guru of mini implants, and went through all the training and everything and found the solution. And now I'm just trying to spread the word and help all the patients and everyone that we can.
So because you perform some of these procedures on family members, have your Christmas gifts improved, Dr. Ackerman? I'm just curious.
Yeah, well, they get better food now. They eat now.
There you go.
Yes.
I like that.
No, I get a lot of questions now, like, you know, hey, what about here? Can you do this?
Sure. Well, they're happy with it.
But I love to do it. It's fun. So I really enjoy it.
And the results, this can be for you. Again, Freedom Mini Dental Implants, 5715263. We shall return more with Dr. Ackerman on Wave 3 Listens.
My name is Brett, and I used to smoke. I quit, but not until I got a serious gum disease. My tip to you is, your smile says a lot about you. What does this say?
You can quit. For free help, call 1-800-QUIT-NOW.
A message from attorney Michael Sullivan about disability benefits.
Have you applied for disability and been denied? Sometimes what's wrong with you, it's just not obvious to a judge. Ever wonder, how do you prove your pain is real? It's not like the judge can see right through you. I'm attorney Michael Sullivan. I've handled disability cases for over 25 years. I will help that judge see not just who you are, but what it's like to live inside your body.
Call 1-888-587-0228. Call now.
Welcome back, Wave 3 Listens. Freedom Mini Dental Implants. Now, when you think about freedom, maybe because of the 4th of July, you think, you know, about freedom, your country. For Glenn, freedom means something different. What do you think freedom means to Glenn there, Dr. Ackerman?
Oh, freedom to smile, freedom to eat. He's got the freedom to eat peanuts again, and freedom to have his phone recognize him again and get it unlocked. That was probably a scary moment for a second. Like, oh no, I can't unlock my phone. But no, just the freedom to chew and the freedom for confidence again, just in overall. I think he's definitely overall more confident with himself. So, for sure.
I think for Glenn, it's like, you know, isn't that funny? You know, your phone doesn't recognize you because it made such a drastic difference and a positive difference. I'd feel good about changing that phone around a little bit. That'd be maybe the first time I felt good about going into an Apple store.
I need help.
Guess what? I've become too handsome. It's an issue. So congratulations to Glenn. And for you, free consultations, right?
Yes, free consultations. Love to, you know, see everybody that thinks that they never had an option or don't have an option anymore. Please come see us, because rarely do we have to tell people they're not a candidate.
All right, again, Freedom Mini Dental Implants. Give them a call today, and we'll see you tomorrow on Wave 3 Listens Live.
Our